cascade. That's, for lack of a better word, that was what Bill came up with, and we all kind of like it, so we kept it. So we used to call it the Cancer Cascade, but it gets, when you start using that word with your clients, that gets to be a little thing. So we just talk about the cascade now. It's a chronological explanation of how somebody goes from being healthy to being with a chronic disease or a cancerous state, and how these, when it says undetectable cellular abnormalities, this means undetectable in that you wouldn't find it on a PET scan or a CT scan or anything like that. That these are not big enough yet to be seen. But whether you think about this, that they're just so tiny you can't find them, or whether you think more in an energetic model, that there's an energetic imbalance that is present before there's a physical imbalance. That thinking that way also works with this. So I'm not going to force you to think anyway. But how chronic disease begins, mitochondria, we'll talk about that. That's an important role. Damage to the RNA, DNA. Evading immune detection, that's really critical. Tumors are very clever. Once they get established, you've got a body that knows how to get rid of cells that aren't you. That's the definition of the immune system, knowing the difference between self and non-self. And if that cancer persists and continues to grow and your body doesn't get rid of it, a lot of times it's not just because you have an immune system that isn't working. It's because the cancer has very specific things it does to hide from your immune system. And those can be undone. We're going to be talking about that. How a tumor is created, progenitor cryptocetes, that's a bacteria, pH, and how a tumor attracts blood supply, angiogenesis. This was some work with Japan. This basically says that we're always in a kind of balance. And the importance of the 75 million cells, it's not that that's big, but that it's not just a few cells every day that we're making that are abnormal. Our body is dealing with tens of millions of cells that are abnormal every day. And not all of them are going to become cancerous. But when you have trillions of cells in your body, and they're all undergoing cell divisions, and you probably don't have a cell in your body that's older than 10 years old, that there's a lot of chances for things to go wrong. I mean, you can have a few 100 million abnormalities a day, and the body knows how. The body has very elegant systems for identifying things that aren't normal and for getting rid of them, for taking care of that. And so, 75 million is felt to be sort of an average. There's an equilibrium between the health of the immune system, total load of abnormal cells. What does that mean? That if you have increased stress, and either the surveillance falls apart, you're not taking care of the abnormal cells that are coming along, or you're producing more as the result of the stress and the inflammation that goes with stress, whatever. But the fact is that you can overwhelm your body's defenses, and now you're in a state where a tumor could take hold. And it only takes about 2 weeks for a tumor to take hold, conceal itself, and now you're on the way to developing a cancer. It may take 12 years to finally show up as a lump, or 8 years to show up on a CT scan. But that people come in and out of stress, and this, we'll talk again just a little bit. I'm really interested in my practice with the whole connection, the kind of poetry between the stresses and the shocks and the conflicts we have in our life and how that settles into your body. Hammer was a German oncologist. He dealt with this. His students, there's now a man in Vancouver, Canada, Gilbert Reynaud, who does a very excellent system that he learned from Claude Sabat, who's a Frenchman. And Hammer thinks that his way was the only way. It's very German. But Sabat in France and Gilbert Reynaud in Canada, they've developed a way of not using CT scans of the head and the kinds of things that Hammer used to do, but just looking at sort of taking where the physical problems are in your life and working backwards to find out how that's connected to the stresses in your life. And I found that to be really useful in physical disease. Just to kind of begin the where to begin the conversation with someone about how is stress affecting your life. And I can give some examples of that. If you have more questions, just bring that up in the question answer thing. And again, what would depress your immune system? You know all of these things. Genetics are probably the least important, but inflammation, radiation, electrosmog, poor diet, emotional stressors. Poor diet definitely includes two when it comes to cancer. foods that your body is sensitized to. So bread is a great food, staff of life, but if you have a sensitivity to gluten, it's poison. Dairy, cheese, those things, some people do well with them, some people, it's killing them. So working with people for food sensitivities is good because that's one of the things that is a part of a bad diet. Emotional stressors, I mentioned toxins, huge. Viruses, bacteria, microbes, huge. There was some, just last year, there were some really interesting electron micrographs showing bacteria that they were taking from people with bladder infections, looking at them under an electron micrograph, and they're covered with heavy metals. That these pathogenic bacteria have sort of developed a pact with toxins, and they just cover themselves with all this stuff, and then the immune system can't see it. So it's, that's always the question, bacteria are everywhere, why do we get sick sometimes and not others? And this is one thing, and the people who do live blood analysis have known this for a long time, that those clumps of garbage you see floating around in the blood, and you can see little bacteria in there, that these biofilms are inflammatory products like fibrin, they're bugs, microbes of various sorts, and toxins.